Well, November is National Senior Pet Month and National Adopt a Senior Pet Month. While everyone loves puppies and kittens, older pets can bring you just as much love and joy. And some actually may be a little intimidated by the idea of adopting or taking care of a senior pet, but that's why today we're going to be sharing the benefits of having an older pet and also talk about the things that you might need to be prepared for as well. So we're joined right now by Dr. Jenny Norman from Ada Animal Hospital in today's Pet Perspectives. It's always great to have you back.
Thanks for having me back.
Yes, and we have the lovely Rocco kind of cruising around
Yes.
here. He's our ambassador, right? He's our little Pet Perspective mascot. We love this guy. All right, so Rocco, he's got a little gray here.
He does,
Yeah.
he does. So he's about 11, 12 years old, so he's my senior pet. And as you can see, he's in a little wheelchair. He has his own kind of senior issues, but still living life. He loves being in the studio here, still
He's
all
so
the joy.
joyful and
Yes.
loving and still so full of life and fun. Which brings us to, when is a pet considered senior?
So for small dogs and cats, around 8 to 10, we need to start really considering them as senior pets. But for our larger dogs, as early as 6 for some of those breeds, we really need to start looking at their overall health and start talking about geriatric care for them.
Okay, and then at what point though do pet parents determine what's actually going on with their pets and when they really have an issue that should be looked at? Right?
Yeah, so it's hard, because a lot of us look at our dogs and we think, oh, they're getting old. This is a normal old age thing.
Yeah.
And it isn't always that. So some of the early signs are we're not wanting to go for walks as long as we wanted to before. We're taking longer to jump up on furniture. We're a little bit slower to rise. Some of those signs are not just normal old age. They can be signs of disease or changes that we can address and do things for our pets.
Okay, so there might be things then that we can help with their quality of life,
Yes.
right?
Mm-hmm.
So they can continue to be happy and
Yeah,
comfortable.
of course.
Sometimes though, I know those symptoms that you were talking about might be a sign of an illness or disease. What are some of the most common diseases that you see?
One of the biggest ones, arthritis, arthritic pain in our pets is a really real thing for them. And again, lots of things we can do to help our pets combat that and still be really good and active. Dental disease, probably one of the other biggest ones that I see in our older pets.
Yeah.
Of course, heart disease, kidney disease, some of those other issues that we see. But arthritis and dental disease, probably some of the most common and also earliest changes that I see in my senior patients.
And when it comes to senior dogs, let's in particular talk about like dental disease. Some of that could possibly be something that owners can try to prevent, at least a degree, right?
There is,
Yeah.
yep, and early intervention. I mean, I'm passionate about preventative care. That's why I went into general practice,
yeah.
Being proactive instead of reactive in our medicine. So starting young with, for example, dental disease, brushing their teeth, talk to your vet about different water additives, safe dental chews. All of those things can help delay and even prevent some of that disease onset.
Okay, so if though a pet is seniored and they're in a situation where they have to have surgery or a really in-depth dental cleaning, let's talk about them going under anesthesia, right? Because that sometimes can be a concern.
It's nerve-wracking. It's especially nerve-wracking as a pet parent. They're going under anesthesia. It's scary, but age is not a disease. So just because they're old doesn't mean that we can't do these preventative measures for them. Now, certainly you need to take precautions before anything major like that. Doing a full screening with your veterinarian, doing a full physical, checking for any underlying conditions, doing full senior blood work panels. Again, looking, because our pets aren't going to tell us. I mean, you see Rocco here. He's happy.
Wish, right? It's
It
like,
would
hey,
be,
what's wrong?
I always say that if they could learn just a little bit and communicate, it'd be so much nicer for everyone.
Yeah, your job would be a lot easier.
It would be, and a pet parent would be a lot nicer too. But, blood work, those preventative screenings, looking for things to make sure that there isn't anything else, and let your vet tailor specific treatments so that something like anesthesia doesn't have to be scary. It can be safe and well managed for them.
Such great advice too, making sure, I'm so glad you said age is not a disease, right? So your pet may be seniored, but they could be in incredible health.
Exactly.
And they will be successful going through a procedure and recover just fine.
Exactly, and that'll prevent them from having those future issues that then could exacerbate other things as they get older.
Yeah, that's really reassuring to hear. Thank you. Okay, but you do also have a final point though to share with our viewers, especially in the way of pain management, right?
Yes, yes. There's so much that we can do for our dogs getting, again, it's not just they're getting older.
Yeah.
Slowing down, all these signs of pain. arthritic pain is something that we can manage for these guys. Joint supplements, other different, there's now stem cell therapies for dogs.
Wow.
There's all sorts of things out there that we can give them that good quality. So when you notice them slowing down, don't just delay on that. Call your vet, get them screened. Let's get them, managed early so that they can keep active and keep being a part of our good, happy lives.
I love that, right? That you want them to have great golden years.
Exactly.
Yes. Okay, so where can our viewers go to learn more?
Our website, adaanimal.com. You can go there or give us a call. Our number is 208-362-5329.
Dr. Norman, thank you so much.
Thank you.
And thank you to Rocco.
Yes.
Such a great little mascot. We love that guy.